Hello, my name is Alicia Carranza, and I am a health educator with the county's Tobacco Use Prevention Program. Thank you for taking the time out of your busy schedule to learn more about how to engage clients around quitting smoking. This is a great way to support your clients' mental and physical health. Today, we're going to talk about how to start conversations around tobacco use with clients and engage them around quitting smoking or vaping. Also, as many of you may be aware, trauma is pervasive among individuals with behavioral health concerns. So we're going to discuss ways to incorporate trauma-informed care in these conversations. But first, before we get started, I would like to invite you to practice an activity that some of you may be familiar with. The 5-4-3-2-1 activity will help us to get centered and ready to be present together for the next 45 minutes or so for this training. So sitting comfortably with your feet flat on the ground, silently to yourself, name 5 things you can see in the space you're in right now. Name 4 things you can hear. Name 3 things you can touch or feel inside your body. Name 2 things you can smell. And lastly, 1 thing you can taste. So hopefully you feel nice and relaxed and ready to learn more about how to work with your clients on quitting smoking. The Ask Advice Refer model is one way to engage clients around quitting tobacco. It's a tool that can be used in as little as 3 minutes. One thing to note is that it's beneficial to ask about tobacco use at every visit because clients' motivation and readiness to quit can shift and change over time. You never know when the right time will be now. So by asking at every visit, you are able to meet the client where they are at. It also helps to remind them that you are there to offer support and resources whenever they are ready. Asking only about smoking and vaping may be associated with stigma for the client, which could elicit a negative response from the start. However, using a more optimal approach, like asking the client about exposure to nicotine, you can do a few things to engage the client around this topic. First, you bring awareness to the differences between their habit and the behavior itself. Smoking is the habit. Exposure to nicotine is more about the addiction. Additionally, because some clients may use chew, hookah, or other emerging tobacco products that contain nicotine, this can be a more comprehensive question to ask clients. Lastly, asking about nicotine exposure can elicit a client's curiosity to what other questions may come next, as opposed to a common response. One such question may get at the fact that the client is currently trying to quit smoking on their own using nicotine replacement therapy, such as patches or gum. This can be a good opportunity to connect the client to behavioral support to increase the likelihood of them successfully quitting. This can take the form of referring them to the local quit line, New Lung, or engaging them in cessation counseling under 10 minutes. This is a billable service through Medi-Cal. Please see pages 32 through 47 in the BHS Cessation Toolkit to learn more about how to bill for cessation counseling. Advising is the next step. This is the opportunity to craft a clear, strong, and personalized message to communicate the benefits of quitting for the client. This can help lead you into the next step of connecting the client to services. So, thinking of a client you know that smokes or vapes, try forming a brief, personalized message that you could give to that client. For example, did you know quitting tobacco can help lower the dosage needed for some medications, such as, and you can share the medications the client may be currently using that you're aware of. Quitting smoking has been shown to improve symptoms of depression and increase well-being. These are just a few examples. It's best to think about what matters most to your client and what's going to motivate them. Now that you've provided a clear and strong message about quitting, you can begin to explore their readiness for help. Posing questions like, have you ever thought about quitting? And how do you think your life would be if you quit smoking or vaping? Can open the conversation. Open-ended questions are ideal at this point because it allows the client to express a variety of things related to their tobacco use. Motivational interviewing is one way to practice advising the client to quit and exploring their willingness or hesitance to quit. The foundational principles of motivational interviewing include expressing empathy, developing discrepancy, rolling with resistance, and supporting self-efficacy. Another way to lead into the referral to services is to use the Readiness to Change ruler. Some of you may be familiar with this tool as well. After providing the personalized quit message to the client, you can then ask them on a scale of 1 to 10, with 10 being definitely ready to change, and 1 being definitely not ready to change. What number do you feel best reflects how ready you are at this time to quit smoking or vaping? So if a client gives you a response, let's say, like a number 6, one way that you can respond to them and engage with them more is to ask a question like, what made you say a 6 instead of a 4? This can help the client to think about reasons they are motivated to quit, consider their self-efficacy, and assess resources that they have available. But what if a client gives you a lower number? Let's say a client responds with 2. One thing you can try to ask is, what would it take, or what support resources do you need to move up higher? What this can do is it can help you and the client explore any barriers that exist, and ways that you can help the client overcome them. Finally, there are many free quit smoking vaping resources available, including the county's local quit line 1-866 New Lung, the state quit line Kick It California, which is also formerly known as the California Smokers Helpline or No Bets, as well as other national services such as Smoke Free Vet and Smoke Free Women, which are text message-based programs aimed at specific populations to offer them 24/7 support in quitting tobacco. The benefit of some of these national-based services are that, again, they can provide the client support during the times that our local and state quit lines may not be available for them. Please remember that the client can use more than one of these services. If the client is interested in signing up for quit smoking counseling through New Lung, they're more than welcome to download an app through Kick It California and or sign up for services through the smoke-free text services. So on page 21 in the BHS toolkit, you'll find more information about how to refer clients to New Lung as well as Kick It California. So on page 23 in the toolkit, there is a form that you can complete with the client during an appointment, and you can email or fax it directly to New Lung staff to give a warm handoff to the client, rather than having the client need to take the initiative to call. Kick It California, the state's quit line, has resources for you to refer through through your EHR, as well as other direct messaging services. The toolkit contains more information about how you can connect your clinic or program to these services. Please remember, not every client will be ready to quit, even when you apply these strategies to work with them. Clients' motivation and readiness to quit can change, and this process may need to be repeated many times until they are able to quit completely. According to the CDC, it takes about 8 to 11 attempts before someone can quit permanently. So every attempt they make is a success. Now you are going to hear some recorded breakout sessions. These will give you a sample of how you can practice asking, advising, and referring some of your clients who are interested in quitting smoking or vaping. Hello, Nancy. How are you today?
I'm all right.
I see from your intake forms you smoke about 10 cigarettes a day and you recently tried to quit. Can you share with me a little bit about your quit attempt?
Well, I know it's bad for my health, and my husband has been trying to get me to quit for a few years now, so I decided to try it again, and I quit about a month ago. I got the patches, and I was doing okay until I got in an argument with my boss last week. I got so stressed out and ended up smoking a cigarette at my break that day. After that, I figured I failed, so I stopped using the patches and went back to smoking.
I understand how stress can be a strong trigger for relapse, and I know it can be frustrating to feel like you missed out on your goal. How do you feel about trying to quit again?
I don't know. My husband is very supportive, but things at work get so stressful from time to time, and I don't know what to do. I can't quit my job, and I'm not in any position to try and look for other work right now.
Mm. It sounds like you are still interested in quitting. What resources and supports would you need to be able to quit?
Yeah, I'd like to quit, but since I can't leave my job and my boss continues to stress me out, I'm going to just end up failing again. I want to quit, but I don't know if I really can.
Hmm. Would you be interested in learning about a free program that can provide additional support to quitting, including education around healthy ways to manage stress?
Sure, maybe it will help.
So New Lung is the county's local quit smoking vaping program, and they have free one-on-one counseling as well as group classes available. Some of the benefits are you're going to receive 2 weeks supply of nicotine patches as part of the program, along with a quick kit that's going to contain some items like toothpicks, mints, and green tea, which are really good tools to help fight cravings. I can send the direct referral form to the program if you're interested in signing up, and they can reach out to you to schedule a counseling session.
That would be great. Thank you.
So, good morning, Kevin. How are you doing today?
Not good. As you know, my asthma is getting worse, and the doctors say I'm probably going to get emphysema soon. I was coughing all morning when I was getting ready for my appointment today, and I feel so exhausted.
I'm sorry to hear that you're not feeling well, and I appreciate you making it to your appointment on time in spite of that. Last week, you mentioned you smoke a pack of cigarettes a day. What is your tobacco use like this week?
Well, it's still a pack a day, and like I said before, I'll likely die with a cigarette in my mouth.
I know quitting can be challenging and nicotine is very addictive. It sounds like you're concerned about your lung health. Did you know that quitting can help improve your asthma symptoms and reduce your risk for lung diseases?
Yeah, I've heard of all that before. I know quitting would help me, and I've thought about it dozens of times. I even tried to quit a few times before, but it never works. I'm never going to be able to live without a cigarette.
Quitting smoking can take many tries, and for some, it can take up to 8 to 11 tries before you can quit permanently. The fact that you were able to quit before is a success you should be proud of. Can you share some things with me about what you like about smoking with me?
I don't like anything about it, but it's one of those few things stopping me from going back to drinking. I don't use Coke, and I just detoxed. I can't quit smoking. I won't have anything left.
Detoxing is a difficult process, and you were able to get through it. You've been able to quit in the past. You're quite resilient, Kevin. What are some things that helped you in the past when you did try to quit smoking?
Well, the first time I quit was when I went to the hospital when I was first diagnosed with bipolar. It was easier then because I couldn't smoke anyway in there, and they gave me medication to help me cravings. But other times I tried were hard, and my anxiety and depression went up after stopping for a few days. I didn't like how I felt, and I couldn't afford to buy anything from CVS like those patches. So I just went from back to smoking.
Mm. It sounds like not having cigarettes available and having access to quit smoking medications helped you quit without any severe side effects. Did I understand that right?
Yeah, I mean, whatever medication they gave me seemed to work because I was in there for like a week and was fine without a cigarette. I had a few cravings, but it didn't really bother me. But I don't know how I can get that medication unless I go back to the hospital. And I don't want to go back there. So I'd rather keep smoking than go to the hospital.
Well, thank you for sharing, and I understand how the thought of being in the hospital again can be unpleasant. I see in your chart that you have an appointment tomorrow with Dr. Goodwin, the psychiatrist. Would you be interested in me sharing some information we discussed so that she can explore quit smoking medications with you during that visit? She can prescribe them for you, and since you have Medi-Cal, you won't need to pay anything for them.
Well, I'm not sure if I'm ready, but I wouldn't mind talking to Dr. Goodwin about getting the medication again. I think if I feel more ready to quit, she's not going to send me to the hospital to get them, right?
Going to the hospital is not required to get a prescription for any of the quit smoking medications. I will send her a note with a brief summary of our chat so she can discuss this in more detail with you. So now that you've been able to take a look at how these principles and strategies can be applied to working with clients around quitting tobacco, I'm going to share a little bit of information with you about how to use trauma-informed care when engaging in these conversations. So what you see right now is the neurosequential model, and it shows that we have these three sections in our brain that help us to regulate our senses and our emotions, help us to relate to others and engage in social connections, and then finally, how to reason, which is that higher level of thinking where we're able to learn and problem solve. You can use techniques such as the 5-4-3-2-1 activity we did earlier to help regulate your clients before engaging them in these conversations. If you notice a client coming into your office for your appointment and they have a heightened sense of anxiety, if you're planning to ask them about their tobacco use and engage them in that conversation, it could be helpful to use that tool 5-4-3-2-1 to regulate their senses, to get them ready to relate to you and engage in that conversation. So by doing that, that can help the client get back into their window of tolerance where they can feel ready to handle the events of their life. Some of the other principles involved around trauma-informed care include safety, trust and transparency, peer support, and voice and choice. One way to incorporate voice and choice for the client is around the nicotine replacement therapy options. Some clients, in my experience, have had adverse reactions to nicotine patches. However, there are 6 other nicotine replacement therapies that are available that can help support clients with quitting and help curb their cravings and withdrawal symptoms. So engaging a client and learning about what tools they may have used during previous quit attempts and what worked and what didn't can help you explore with them what nicotine replacement therapy they might be interested in trying and how you can work with them to connect them to that resource. It gives the client, again, that opportunity to express their voice and ultimately make it their choice of what's going to work best for them. So to summarize our training for today, it's important to ask about tobacco use at every visit. Any day could be the day that that client is ready to quit. And by asking about tobacco use at every visit, you're giving them that opportunity to seek support. Remember to provide clear, strong, personalized messages to clients. These messages are important to getting the client to start developing that discrepancy between goals and things that are important to them and their tobacco use that can potentially get in the way. Please remember that there are free resources available to help your clients. Again, we do have free quit smoking services, smoking and vaping through New Lung, our local Orange County cessation provider. Clients who sign up for services through New Lung will receive a quit kit that contains resources such as toothpicks, mints, gum that help with that physical part of the addiction. And they'll also receive a 2-week supply of nicotine patches that help with cravings and fight withdrawal symptoms. There are also free resources through the state's Kick It California line, where clients can also receive nicotine patches. And there are also free text-based and app resources that can help clients 24/7 to fight cravings and support their tobacco-free lifestyle. Please keep in mind that the ask, advise, and refer model may need to be repeated multiple times. It's more of a cycle that you're going to run through with clients until they're eventually able to quit permanently. But again, please remember, every attempt they make is one attempt closer to being able to quit permanently. And finally, it's important to use trauma-informed principles when engaging clients around quitting. Whenever possible, I would encourage you to use those tools when engaging around quitting because there is so much stigma around tobacco use. And because for some clients, their tobacco use could be tied to their trauma. So it's important when trying to work with clients around quitting to use those principles so clients can feel safe and know that they're supported. Thank you again for taking the time to learn more about how you can support your clients' mental and physical health. Please take a moment to click the link here for our post-training survey. We greatly appreciate the feedback that you provide to us so that we can better serve you and your clients. If you have any questions after this training or need any additional resources, please feel free to reach out to me either by phone or email, and I'm happy to provide you any resources that the Tobacco Use Prevention Program has to offer.